The Honourable Member for Mermaid Stratford and the Opposition House Leader. Two cups of water.
Thank you, Mr. Speaker. I want to start by thanking the many public servants in the Department of Finance and those across all departments who have worked hard over the last weeks and months to put this budget together, certainly not week. Developing a budget is a very big task at the best of times, but developing a budget over the last year with all the disruptions of COVID has certainly made that work much more difficult. Not only that, but because of the new legislative calendar, this budget is being presented earlier than in the past, and only 3.5 months since last fall's capital budget. Again, to all the staff that have worked on this budget tirelessly, thank you for your hard work and your dedication to public service. I know I speak for all members in this House when I say that we couldn't do the work we do on behalf of Islanders without you. A year ago, our province, like the rest of the world, was struck by the impacts of the COVID pandemic. We recognize that the pandemic has placed extraordinary burdens on Islanders, especially vulnerable Islanders and those in marginalized communities. Islanders needed their government to step up, to support them during these difficult times. That's why we were glad to see over the last year that this government relaxed its fiscal restraint. If ever there was a time to spend, this was it. Many of the programs this government rolled out over the past year were indeed helpful to Islanders, and kudos to the government for doing that. However, as the Premier has acknowledged, the response certainly wasn't always perfect. Our caucus proposed a few ideas to help alleviate some of the blind spots that remain in government's pandemic response. Unfortunately, from this budget, it looks like government is content to stay blind to some of these concerns and the needs of Islanders. We ask this government to put its money where its mouth is, in supporting low-income essential workers and frontline healthcare workers. And I guess since there's no money in this budget, in this regard, we can safely say government is not too concerned about recognizing frontline and essential workers. Just more stories, no money behind the words. Put your money where your mouth is. While it looks like we will have to continue to fight COVID for a while yet, we can now see the light at the end of the tunnel. With the vaccine in sight, our focus is shifting from public health response to the economic recovery. Unfortunately for government, there is no Dr. Morrison to lean on for the economic recovery. It is up to government to step up, provide a clear and compelling vision, and lead this province through these challenging times. Unfortunately, Mr. Speaker, the government has continued to dance around the release of an economic recovery plan. We still don't have the economic strategy the government funded in 2019, before the pandemic. Government is putting this House in a very difficult situation. It presents us with a budget it suggests is necessary for our province's economic recovery, without having provided this House with an actual recovery plan. That does not sound like a government that is prepared to respond to the economic challenges ahead of us, let alone one that is equipped to transform our economy for the betterment of all Islanders. Where is the vision, Mr. Speaker? The opposition has been calling on government to promote a just and fair recovery. We've emphasized the need for improving the wages and working conditions of island workers. We spoke about reducing the debt of our young generations, to empower them to start their lives and support the local economy. We spoke about the need to rethink how we support island businesses, whether the approaches of old were truly the best way to approach them. We spoke about the need for climate mitigation and adaptation. We've emphasized the need to get the housing market under control and make housing affordable and accessible for all islanders. Frankly, government's plan, if you can call it that, is severely lacking. Mr. Speaker, many people have spoken about the great pause. The idea that COVID provided an opportunity for government to reflect on the status quo and whether it has been truly serving everyday islanders. It appears to me, based on the document presented in the House here today, the government has wasted this opportunity for reflection. In its own words, government has no intention of being revolutionary at a time when ambition and imagination are needed most. And Mr. Speaker, evident in this budget, the plan for economic recovery is paper thin. If COVID has been death by 1,000 cuts, this budget is crisis management by 1,000 bandages. Islanders have been delivered a smoke and mirrors budget filled with boutique promises and little more. This government loves talking about collaboration. Unfortunately, that is a lot of talk. Mr. Speaker, the official opposition provided a robust submission of budget asks. In the minister's speech, she claimed that 30 of the 35 requests from this side of the House are at least partially included in the budget. This is a nice story, but the devil's is in the details. And apparently, with the minister's math, of the 20 submissions our caucus proposed, at least 8 were completely ignored, and most of the rest are only partially met. Now, I do recognize that government wasn't going to adopt every single suggestion that we made. They have their own priorities, and they make the decisions, not us. We propose the government give low-income seniors on a fixed income a break in their taxes. Nothing. Last fall, my colleague from Tyne Valley Sherbrooke put forward a motion calling on government to offer the shingles vaccine, and this motion was passed by this House. I'm glad to see this finally in the budget, but I have to note that this government has been promising this for 2 years already and haven't managed to deliver it yet. Hopefully, they manage to get their act together this year. It's pretty clear that this government has a recurring problem with delivering on promises. And I'm not even talking about their platform promises. We've seen over and over this government announce some great new programs, more than once, I'll add, but they fail to actually implement the change. So, Mr. Speaker, I have to ask, which of the promises in this budget does this government intend to ignore? If we look at their record and if we look at which of the opposition proposals they've adopted or not, we can see a pattern. Expanded dental care for low-income islanders? No. A basic income pilot for islanders? No. Meaningful action to address the housing crisis? No. Tax breaks for low-income island seniors? No. Addictions navigator position? No. Mobile mental health teams? That's a mess. So we'll see. This government drops the ball on things that would benefit the most vulnerable islanders. Just this morning, the Premier talked about how his government was moving forward, taking action and implementing initiatives that the previous government could not. Well, Mr. Speaker, I respectfully disagree. Government's #1 priority over the last 2 years has been mental health, in words and stories at least. But what has this government actually done? The mobile mental health units, just listened to question period this morning, they are a mess. The one service that advocates and staff alike were excited about was the psychiatric urgent care clinics, the PUCs in the Hillsborough Hospital. We were told that patients felt safe and respected at these clinics, and staff were excited and motivated to work in an environment that was actually helping people. Then they were suddenly closed, with no promises of reopening, but as usual, no action, with the promise of reopening, but no action as of late. The new mental health hospital that this government was elected on seems to be all but forgotten. The third option, an evidence-based, important option for women who have suffered sexual assault, has yet to be implemented. We've been told for almost a year that this option is almost ready to go, but yet again, no implementation. Every time a delay happens, it may not feel big to us here in this house, but let me tell you what happens. Every day that PUC remains closed, Islanders who need mental health or addiction services fall through the cracks. Every day that the mobile mental health units aren't operating, Islanders don't get adequate help they need when they are in crisis. And every day that the third option isn't an option, women are raped and are forced into impossible decisions in the midst of trauma. Delays in promised programs don't just undermine the trust of the public, they affect real people. Real Islanders, and that trauma is something that they never get back. The mobile mental health units mess that has unfolded this week highlights how this government really feels about our frontline healthcare workers. They talk a good talk, but there's not real respect given on the ground. So I shouldn't be surprised that the two requests that the official opposition asked for in the budget to help healthcare workers and show them our true appreciation for what they provide us weren't in this budget. We asked for a frontline healthcare worker bonus, which was not provided. We also asked for dedicated childcare spaces for essential workers, something that unions have been asking for. And they've been asking for it for years. The biggest spending item this government did include in their budget for frontline healthcare workers was recruitment funds. We're going to spend a lot of money on recruitment, new healthcare professionals who will always be treated with a lack of dignity, support, and respect, and they will just end up leaving, thus costing us more in recruitment funds. It's a vicious and never-ending cycle that has to stop. Give our healthcare workers something to stay for. They want to stay here on the island, so give it to them. They want to help. What we hear from healthcare professionals is that there is no plan. From those in the hospitals, long-term care, clinics, West, East, and Central, they all say the same thing. There seems to be no plan for healthcare here on PEI. Lots of great stories and buzzwords, lots of great siloed programs, but no overarching plan. This government clearly has some lofty goals for health, but without a plan, goals are nothing more than a dream. In our responses to the speech from the throne, our caucus encouraged government to be critical of the status quo and thoughtful in its budgeting and expenditure of funds. Over the last 5 years, we've seen revenue growth in personal income tax far exceed growth in corporate income taxes. We have a government that refuses to use its taxation policies to cool speculation in the housing market. We even have a government that wants to make more money through the misery tax of online gambling. Should Islanders be happy about those trends? Mr. Speaker, government must generate revenue ethically and sustainably. Whenever we spend money, we always have to ask ourselves, is this the best use of public funds? Are there better ways to achieve our policy objectives? There are important questions. These are important questions. They can open our eyes to better options, better solutions, better approaches. But I'm not convinced these are the questions government asks itself. For example, the basic personal amount is often touted as an effective way to deliver relief to low-income islanders. Is it really? 2017 tax data from the CRA shows there were more than 14,000 islanders with income returns below $10,000. Of course, since then, that number has presumably gone up. These islanders don't have enough income to benefit from these tax measures. In fact, a person earning $150,000 would receive more tax relief from these measures than a low-income tax filer. And no person would make more than $74 a year through this tax policy. Mr. Speaker, these increases cost the province millions of dollars in foregone revenue. And sure, it does provide some relief to some islanders, but is it the best way to support islanders? Would money have been better spent on our healthcare system to improve access to primary care and mental health care? Would it have been better spent addressing the housing crisis? Would it have been better spent supporting the struggling tourism sector or our island farmers? Government has the ability to use the tax system to achieve its desired policy ends, but it doesn't want to do that. We've heard the Minister of Environment go on about modeling. Where's the modeling on the government's tax policy? The official opposition asked for a vacancy tax to curb speculation and ensure that residential properties are being used for housing. Again, government has taken no real steps to do this. Mr. Speaker, I'm sure the Minister of Finance is quite aware someone will have to pay for the recovery. Whether government wants to admit it or not, taxes pay for services. I've seen a government that has favored businesses more than islanders. The Canadian Centre for Policy Alternatives report picking up the tab, which frustrated government very much, and whose findings were disputed by government. I understand that. They did have one claim that this government has done little to dispute. Government has spent more to assist businesses than it has to assist individuals. More and more often, we are seeing signs that it's not about the people. It's about profit. Like the throne speech, this is a very underwhelming budget that fails to rise to the occasion. It's clear that this government has no vision for the future of this province. Government has managed through the COVID crisis thanks to the heroic efforts of Dr. Heather Morrison and our healthcare workers, as government has said. But it has so far completely failed to provide any kind of strategy for the post-COVID recovery. This government's disjointed approach, a story of boutique promises, amounts to little more than crisis management by 1,000 bandages. Is this the best budget this government could offer? No. Is this truly the best budget this government could offer? On this side of the House, we expected better. Thank you, Mr. Speaker.